Here we're going to talk about cardiovascular issues, arteriosclerosis, coronary artery disease, congestive heart problems. We'll get through the root of all of this. Cardiovascular disease in the U.S., there's about 74 million people who have it. Congestive heart disease, 17 million. You look at the reality of all this, the annual cost, $70 to $80 billion a year in the U.S. alone. 1 in every 3 deaths is attributed to cardiovascular disease. As far as the traditional evaluations go, there's a gap in the way that people are evaluated. And 50% of the patients with cardiovascular disease and problems still have congestive heart disease or heart attacks despite normal levels of all the normal risk factors that are measured medically. Because of this, it becomes very obvious that they have reached a limit in the ability to reduce these problems with traditional tools, and the conclusion of that is mandatory that we use functional and metabolic medicine to start to begin to evaluate these processes, because these are the end result of a problem. They aren't a problem in and of themselves. When we look at this, there is a continuous increase in systolic blood pressure as age increases. There is a inverse relationship with the rising blood pressure in people 85 years or older. That means the higher the blood pressure goes when you get older, the healthier you are, not the other way around. Better survival rate in men age 85 years and older, and it's possible just because the organs need more blood supply to stay healthy. The blood vessel has only 3 responses that it can have for an infinite amount of things that will insult or injure the blood vessel. Those 3 finite responses are inflammation, oxidative stress, and immune dysfunction within the arteries. Here's a picture of what an artery looks like, the arterial wall. The lumen is a space where the blood flows inside. The lining of the lumen, called the intima, is 7 times smoother than glass. The media is a mixture of smooth muscle, protein, and elastic materials to allow the artery to expand and contract. And the adventitia, the outside, is a really strong fibrous tissue. 50 to 75% of patients that are hospitalized with acute heart attacks, that's what a myocardial infarction is, have normal cholesterol levels. 25 to 50% of patients have none of the top 5 traditional risk factors. Here is what really happens within the disease process. On the left side, we have a minimal amount of plaquing going on inside of an artery. In the middle, there's a moderate amount, and in the far left, we have severe stenosis going on. Stenosis means the lumen size has reduced a lot because of plaquing going on. The plaquing actually occurs not inside of the lumen, but somewhere in the media, in the middle part of the artery. The prevalence of arteriosclerosis or plaquing increases with age. Typically, it's expected that over 50 years of age, 85% of the people have some degree of plaquing going on. This is what an angiography looks like in an internal ultrasound. The angiography is on the left side, and you can see how full the artery really is. On the right side is where an ultrasound catheter has gone inside the artery, and you can actually see the plaquing going inside of the intima to let us know how thick the plaquing is. This is a much more diagnostic study that isn't done all that often to see what the true health of arteries are. Here's the anatomy of what a plaque really looks like. The lumen is a black spot in the middle. The media is typically what happens is free radicals start to break through the intima, go into the media, start to cause an inflammatory reaction where the white blood cells called the T lymphocytes and macrophages turn into foam cells. Those foam cells are the result of a major inflammatory response. Then cholesterol follows in to try and calm the foam cells down and stop the inflammatory process. That fills up more space, and when the cholesterol's been there for a long time, it'll start to calcify and the plaque will become hard. This shows the different types of plaques that can develop. The early plaque on the far left is got a lipid pool. That means there's fats that are starting to deposit inside where the injury inflammatory response is going on. In the top middle, you have that lipid pool is starting to die and starting to waste away. It's still a stable plaque because the lining headed toward the lumen or the opening is really thick. If we look just below that, you have a thin cap, and that's not a very stable situation because it doesn't take much for that plaque to break through the arterial wall. On the far right, there's a ruptured plaque where some of the contents of that plaque have actually gone inside the lumen and caused a major inflammatory response. That'll cause a thrombosis, which typically is a clot mixed with a bunch of other things that can go distant down the road, lodge someplace, and not allow blood flow, no nutrients, no oxygen. That's the result of, or heart attacks are the result of that, strokes or pulmonary emboli. Here's the progression of what the plaquing looks like. At the top, you have the initial lesion. Fat starts to invade as we come down. An intermediate lesion starts to get thicker. Atheroma is getting quite thick with recognizable difference of streaks of lipid. Fibroatheroma is fibrous tissue and fatty tissue mixed together. And the complicated lesion is where you have all this mixture and it starts to break through the intiman and go inside the lumen. As this process happens, it roughens the lumen. The blood vessel or the blood cells start to tumble as they go through there. As they start to tumble, they can start to stick together. That can cause its own blood clots that are loose, and those can become thrombosis, go lodge, and cause heart attacks, the strokes, and the pulmonary emboli also. Hypertension is a result of all this because the arterial wall starts to get quite stiff. The heart typically just pumps blood a quarter cup per beat, no matter how many beats you're doing a minute. It's supposed to go into relaxed artery wall. The artery wall is supposed to swell or get bigger so that it can receive all of the blood. Then the artery wall slowly compresses to keep the pressure, to keep the blood flowing. Well, when you look at hypertension or high blood pressure, it's not a disease, but it's a reaction to the blood vessel inflammatory process that ends up resulting in plaquing. Elevated blood pressure is just one of the many responses we have to all of this going on. The vascular health is determined by several different factors. The ones that dilate will allow a normal elastic artery and blood pressure stay low. That's typically a result of nitric oxide. Nitric oxide will cause dilation, growth inhibition of plaquing. It stops the formation of clots, anti-inflammatory, and an antioxidant. Angiotensin does quite the opposite. It constricts the blood vessel. It promotes growth of the wrong things. It will cause blood clots. It's pro-inflammatory and pro-oxidant. The level of blood pressure elevation is dependent on the abnormal blood vessels that go on with remodeling of the small resistance arteries that we were talking about earlier, typically through the plaquing. So there's several responses that go on to these typical problems. There's an oxidative stress. That means you have free radicals going in and start to... So the oxidative stress will react within the arteries and the kidneys. Inflammation starts to go on within the arteries. Then there's autoimmune dysfunction that goes on within the arteries and the kidneys. Abnormal vascular biology, that means endothelial or the lining dysfunctions. The smooth muscles start to change. You start to get the plaquing going on. And then there's genetic issues that will create issues also. In order, the most accurate assessment tools are 24-hour ambulatory blood pressure measurements. That means when you're up and walking throughout several measurements throughout the course of the day. Out of the office, measurements of blood pressure are typically better than inside office because of white coat syndrome, where people are afraid of their docs and their blood pressure will rise for that. The typical blood pressure cuff is next in line. The in-office automated blood pressure measurements, and then the other blood pressure measurements is what the aneroid is, typically done inside a doctor's office. Hypertension is typically considered things that are above 120/80, but the risk for cardiovascular disease actually starts on 110/70. The interesting thing is for every 20 millimeter increase in systolic or 10 millimeter increase in diastolic blood pressure, the risk of hypertension and cardiovascular disease is doubled. There's normally a dip in the blood pressure in the middle of the night. That dip should be about 27 points on the first number, which is the systolic, and 15 on the second number, which is the diastolic. This is a normal pattern. When that's not there, there's more problems. It complicates the way things need to be addressed. Recent findings show that this is all a circadian rhythm. That means that our day-night cycles, there typically is going to be a dip in the nighttime. This lets us know that high blood pressure isn't a syndrome. It's a lot more than just blood pressure. It's a multitude of body systems that are reacting and responding to create this. The arteries don't breathe. They don't expand and contract normally like they should. The lining starts to become dysfunctional. Blood sugar changes. Hormonal changes. Kidney changes. The kidneys have a lot to do with circulation. Blood clotting changes. Abnormal insulin because the glucose is rising. Lipid problems. Obesity. There's a lot that's involved with all this, and all these are results of metabolic problems, primarily our dietary lifestyle. Here's a breakdown of some of the key risk factors that lead into artery disease, whether that's in the arteries in the heart or just cardiovascular disease in general, or in the brain or in the kidneys. Hypertension, the same thing. The main cause of this is the three causes that we saw before: the oxidative stress, the inflammation, and the autoimmune problems. Weight does have an impact on blood pressure, but it's not necessarily just the more weight we have, the higher blood pressure. There is fat deposits inside of us called visceral obesity. That's the most important. we need to reduce that component, not just our weight. Our muscles actually weigh a lot more than our fat does. And oftentimes people who do radical weight loss, it's the first weight that comes off is just water. The second weight that will come off is from protein starvation, will be muscles, and there may be very little change in the fat content within the body. There's special equipment to measure that fat intake or that fat composition within a body, and that's not a common thing in most offices. Exercise, regular aerobic exercise will lower their blood pressure significantly and reduces the coronary or congestive heart disease. But we really need a combination of aerobic and resistance training to make that balanced. Sodium or salt, it will increase the cell stiffness and reduce the size, surface area, and volume of the lumen, so that the arteries are a lot more rigid. They will not grow with each pump of the heart, and that'll give us a much higher systolic blood pressure. Potassium counteracts that. If we look at this, here's some more issues. The potassium will lower the blood pressure considerably. Here are some goals. Reduce sodium intake to 1,500 to 2,000 milligrams a day. Increase potassium intake to 5 grams a day, and that will bring a lot more balance as far as that goes. That can be done just through foods. Magnesium is actually the best calcium channel blocker, natural calcium channel blocker there is. It also will dilate the blood vessels. Part of the reason for that is muscles can contract without calcium, but they can't relax, and the magnesium helps that process. Then there's natural anti-hypertensive compounds. Essentially, that means things that will stop blood pressure from rising and actually reduce it. Those are natural compounds, and they may be less effective and take longer to work than blood pressure medicines. But when they're used in combination with other nutrients, they add their effect. It becomes magnified, and it's pretty powerful effect. Some of the natural diuretics, vitamin B6, taurine, celery, vitamin C, potassium, magnesium, protein, coenzyme Q10, L-carnitine, hawthorn berry. Here are some natural beta blockers: taurine, potassium, zinc, protein, vitamin C, B6, CoQ10, celery, garlic. Vasodilators, omega-3s, potassium, magnesium, soy, flavonoids, vitamin C, vitamin E, CoQ10, few amino acids, celery again. Celery apparently is quite good for cardiovascular health. Calcium channel blockers, alpha-lipoic acid, magnesium, B6, C, E, N-acetylcysteine, hawthorn, celery again. Calcium, garlic is prevalent through most of these. Angiotensin converting enzyme inhibitors, garlic, seaweed, sardines, hawthorn berry, pycnogenol, gelatin, omega-3s, egg yolks, fish sauce, zinc, melatonin, pomegranate, angiotensin receptor blockers, potassium, taurine, resveratrol, B6, CoQ10. Celery is throughout this, C is throughout this, garlic is throughout this. We commonly believe some really mistruths about dyslipidemia or cholesterol issues. I was recently at a conference where a couple of speakers talked about this issue. One was an osteopath who knew some of the team who implicated lipids as being the major problem for cardiovascular disease. And he approached those people because they were friends, and he said, "Hey, how come you guys publish the results? Because your studies don't actually support the results you were published." And some of the men on the team said, "Yeah, you're right. It looks like they were paid off." This really hasn't been the issue, but they've been able to make a lot of money off of this. The reality is, I don't have the slide on this one, but at least 40% of the world's literature has been twisted for special interest purposes, and it's considered that up to 70% of the literature produced by the U.S. is the same thing. Most of that will be paid off by people who have a chance to make a lot of money off of misinformation. The most common underlying reasons for your lipids being out of balance is really chronic inflammation, immune dysfunction, and oxidative stress. This creates metabolic, inflammatory, and immune and infectious. Endotoxemia are also in there also. Typically, an inflammatory diet will increase with circulating endotoxins. The reason why that is, the inflammatory diet creates leaky gut. The leaky gut allows pieces of pathogenic bacteria, yeast, fungus, parasites to get in the bloodstream. That overwhelms the liver. It overloads that. Also, whole proteins get into the blood. That starts to create allergic responses that can turn into autoimmune problems. It also creates food intolerances. All of that will create inflammatory responses everywhere in the body. It also will create a fair amount of protein malabsorption. Without proper protein absorption, none of your tissues can heal. The arterial walls are full of muscle. They need protein to stay healthy. You deplete the protein intake, and the muscle walls, the arteries don't get healthy, and you have a nightmare going. The infections typically will cause changes in your lipids through what's called LPS. Those are the cell walls of gram-positive bacteria and some of the other pathogenic things that grow inside the gut. There's actually more bacteria inside the gut called the flora than there are human cells in the rest of the body. That controls the bulk of your digestion, like 95% of it. When the gut leaks, those get out, those create autoimmune problems and will start to change your lipid profiles throughout your entire body. The pathogenic burden of various things that leak through the gut has a correlation, a real significant correlation with endothelial dysfunction or your arterial wall dysfunction. Also brain dysfunction. If you have a leaky gut, you have a leaky brain. Also autoimmune problems also. Here's a picture of the inside of a gut. The cells on the arc going around on the left side are close together. Those are tight junctions where proteins can't leak through. You start to get toward the top in the middle where you have damage from like celiac disease, chronic inflammatory things going on. You have whole proteins leaking through, cells breaking down, injury in the wall of the gut, and all kinds of things go in and outside of there that shouldn't. Whenever there's a leaky gut, there's always a leaky brain. This starts to cause some of the pathogenic plaquing within inside of the brain, and that's not good. The LPS, or the fragments of the bacteria that come out of the gut, those act as superantigens for the T lymphocytes and start the autoimmune problem. Heavy metals will also cause similar issues. They start to dysregulate people's lipid profiles. Here's what the cell membrane looks like, typically of any cell membrane, but in this particular case we're looking at the arterial walls, the inside lining of that, and there's a whole host of things that are in here. Typically what happens is free radicals come in, start to create some oxidative damage in these, and they start to leak, and then you have major problems everywhere. Here's what a typical lipoprotein particle looks like. There's several different parts of it. One of the big things is these carry lipids. They also are supposed to carry the LPS and other pathogenic things and take them where they can be processed. The role of LDL and HDL, both they bind to LPS to prevent LPS to activate, some of the white blood cells to create the foam cells and all the pro-inflammatory responses that leads to what we started off with, the arteriosclerosis and the vascular disease. Monocytes and macrophages, they increase a long-term memory after they're stimulated by the LPS. That means they create their own memory. Once that memory starts, it will perpetuate even though there's no threat that goes on. So whenever you compromise the gut lining, it sets up injury in the lining of all your arteries, all your blood vessels, throughout your brain, everywhere else in the body. So the gut really is a root issue, even in cardiovascular disease. Postprandial hyperglycemia, that means after eating. Whenever the blood sugars rise after eating, the fats rise with it also. That creates toxicity, both of blood sugar and fat, and that immediately will start to create dysfunction within the lining of all the blood vessels. It increases the inflammatory cytokines. Those are byproducts that create inflammation, and all the cells will get a metabolic memory. They'll remember the responses and continue the responses even though you quit doing that. So high sugar foods, high fat foods, they cause a lot of this. So the summary of all this, the whole issue of cardiovascular disease, it's a post-eating problem. It lets us know our dietary lifestyle is the root of the issue. And there's a whole host of reactions that go on downstream from that. So our eating lifestyle is much like a tsunami coming into land like this picture is right here. That would be a very scary thing to be living there and seeing a 100-foot wall of water like this coming at you. When it breaks, it's very destructive. This is exactly the way our dietary lifestyle is to our arteries. So we look once again at the arterial plaque formation. We have free radicals break through the lining. That creates, that drives a monocyte cells to go in there. Those start to enlarge. They become foam cells. The LDLs and the cholesterols, they start to go in to try and calm the plaque down. That starts to grow, becomes this great big huge plaque, and if that becomes unstable, the plaque starts to die from the inside. Not much of a lining on the outside, or ruptures the membrane, causes some type of thrombosis, and there you have an accident waiting to happen: stroke, heart attack, pulmonary embolism, or maybe a minor tissue. LDL and HDL, they help regulate inflammation, oxidative stress, and immune dysfunction. HDLs decrease the inflammation. And when you look at all this, some of the most functional ways to treat the lipid problems, if you look at statins and niacin in the small LDLs, which are the ones that really cause a problem, it's as effective as the statins. But the interesting thing with the niacin, it'll actually pull plaques out of your arteries as well as reduce the cholesterol, so you can actually remove the plaques and have normal, healthy blood vessels if you use niacin. And niacin is a healthy issue. It creates health in the other tissues. There's no complications that go on in other areas that you have with the statins. High HDL may not necessarily be that healthy. It may be because there's mature HDLs in the plasma, which is good, but if they're not carrying the lipids back out of the tissues, it's not good. A low HDL may signal a decrease in the need to carry the lipids, which is be good, or it could be because the reduced peripheral cholesterol collection isn't working, and that's not good. So we can't just look at a couple figures and say, oh, we're healthy and normal. HDL, liver is the main site where those are cleared, where cholesterols are cleared and the kidney is involved in the entire process. HDLs of 85 or better, typically that's going to carry mostly the dysfunctional HDLs, niacin, quercetin, pomegranate, resveratrol, glutathione really reduce this and help bring us healthier HDLs. Here's a graph of some of the treatment protocols. You can look for things and how they affect different things. Typically, this is a lot of natural products right here: garlic, curcumin, fish oil, citrus, bergamot, plant sterols. In that, there's going to be soy, lycopene, berberine is really huge in this. You see throughout that garlic, celery, potassium, berberine are huge in inflammatory response, normalizing blood vessel wall issues. You add some niacin in there, you can start to pull out the inflammatory response in the cholesterol, and it's huge what you can do with natural things. So here's some nutritional supplement and treatment recommendations for those who just try and go off a book. Red rice yeast helps lower cholesterol, plant sterols, berberine, niacin. But the reality is you start just blindly doing this, you don't really understand what you need. There's no way to test or retest to assess what the progress is, and it's pretty hard to do this out of a book and really manage things. It's a real hit and miss process. You really need a proper evaluation to sort things out. Here's some more of the nutritional treatment recommendations. The reality is, if we look at it, this is the root issue on what we need to do. How we eat determines what our health is going to be. Arterial health, gastrointestinal health, general overall health. We need a lot more veggies, at least 5 servings a day, multiple colors. You can make it easy and do it that way, or you can try and count every little thing that's there. But if you do at least 5 colors of vegetables a day in several servings, you pretty well got it. Add fruits in there, quite a bit better. Combinations of the phytochemicals in the different color fruits are very protective. Vitamin E, or actually omega-3 fats, this is typically your fish oils, which, by the way, most fish oils are rancid before you buy them off the shelf. There's only a few manufacturers that make good ones. We store ours in the refrigerator because rancidity is such a huge issue. But it undoes most of the things people are afraid of. And when you look at the bottom line reality, nutrition has a 17-to-1 return on your investment for your health. That means for every dollar you spend on nutrition, you're going to eventually save $17 in health care. That's pretty huge.